Now, I've seen some of the information that comes through to the Chief Health Officer throughout the night, really complex, detailed medical information that the general public are not going to be able to make sense of, as far as the CT values and where they're at and what day they're at and where they've been. This is complex stuff from so many different sources. The Chief.
Treat people like they are children.
The member for Everton. The member for Everton will cease his interjections. The minister has the call.
It is offensive. There is not one jurisdiction in this country that has released complex, detailed medical information that sits behind every decision that's made. What they have tried to do is to provide clarity and simplicity to the messaging so that people understand, because this is a complex issue. Every day, the Chief Health Officer is getting reports on sewage and where that sewage is in every jurisdiction and where the cases are in other jurisdictions. It's not just about what's happening here. She's getting reports globally what's happening. We're having a look at the cases coming into Queensland internationally, what's coming across our borders, what the risks are in other jurisdictions. Every case is different. There's not a one-size-fits-all. You can't put a manual out and say this is how it works. There was no manual on this. The World Health Organisation, they put information out, but it is information that is digestible for the public because they understand the importance of the public knowing how this works and what it means. But it's not all the complex science behind it and all the clinical information that sits behind it. And I don't want the Chief Health Officer having to get up every morning and collate all of that into a single report that can be uploaded online every day for everyone to have a look at to see, what's the reasoning for today's decision of what do we need to do today? That also isn't just a daily thing, it's an hourly thing. Once we finish our assessment in the morning, the Chief Health Officer goes off and sits down with the AHPPC and has further discussions about what is happening nationally, what is happening internationally, what are people's concerns about risk going forward, what do they think that risk modelling is, what should we be looking for, what's happening with the sewage, is that a sign that we're likely to have positive cases, the positive cases that are coming up, what are we seeing from that, what are we seeing with the new variants, what are we hearing internationally with the new variants, do we need to be concerned of what's coming next? I mean, what would they want us to release? Or would they want us to simplify that into a single sheet for people to understand? And then they'd be saying, but we want to see all the data behind that. As far as planning and information and why some people... Look, the people of Queensland do have trust in the decisions that Chief Health Officer has made and that the government supports. We know that because they supported us again at the last election. But I also know that because every single time I step foot outside, in my supermarkets, in the community, at different business events, it doesn't matter whether it's a Chamber of Commerce event, whether it's a community organisation, whether it's me just doing grocery shopping, I get someone coming up to me saying, thank you. Thank you for keeping us safe. Can you please pass my thanks on to the Premier and the Chief Health Officer? So they have confidence. The opposition might not have confidence, but the people of Queensland do.